Hi, I'm Junisha Mascarenhas and I am a physiotherapist. I've been working in this profession for around 8 years and most of my career has been in physiotherapeutics. Today I'm going to talk about dry needling. Dry needling is very common these days, you must be aware of, since everybody is posting Instagram posts everywhere and all are talking about it, about getting this needle stuck inside and getting the muscles released. So what is dry needling? Dry needling is a therapy wherein we insert a thin filament like needle in the muscle to get the muscle and the muscle tensions relaxed. What all do we needle? We can needle a muscle knot, a tight structure, a scar which has become adhered to the underlying tissues, a myofascial bend wherein the entire muscle gets stiff, because of which the movements are hampered. So we insert this needle in the muscle, get it released, and thus the patient is better to work. When I say dry needling, needles entering the skin, is it painful? Is it scary? Is it uncomfortable? Okay, so dry needling, as the needle is inserted, it is minimally painful or moderate painful, I would say. Does it bleed? Not at all, maybe a blood drop, that's all. Is it scary? Is it going to be dangerous? Not when the therapist is well equipped and well trained. If it is done with all the aseptic precautions and with the correct techniques, there is no danger at all with dry needling. It is also important to note that dry needling is not acupuncture. Acupuncture comes from Eastern medicine. Dry needling follows Western medicine, where we assess the patient's muscle, we palpate the muscle, assess for the trigger points, the myofascial bends, the tightness, we check the movements, check the posture, the various orthopedic tests, and then we come to a conclusion what and where it has to be needled. Here we have this patient who has been complaining of knee pain, and after assessment I have come to a conclusion that his quads tightness is the main issue that is giving him the knee pain. So now to release this muscle tension over here, and there are a couple of knots over here in his muscle, I will be using dry needling, which is the best therapeutic approach for this condition. I have taken the patient consent for dry needling and now I start with my procedure. I am taking my aseptic precautions with my gloves on, cleaning the area to be needled. So needles come in various sizes, that is the large, medium, small, depending upon the area to be treated. For larger muscles we use bigger ones. Now why do we do needling? We have these muscle bends and knots which we are trying to get rid of, for which we insert the needle directly into the muscle area and try to release it. We use a couple of needles going in the same muscle depending on the bend area or the tightness area or the stiffness area which is presented in the patient. I am taking care of all the blood vessels, the nerves supplying the leg. Dry needling therapy is totally safe and is not having any side effects or any hazards unless done by a trained professional and with all the precautions. Hope this video was informative. Please do not practice this at home on your own or with untrained people, as this can cause severe damage, and it is very important that your anatomy is very clear before you practice this. The clinicians over here are well trained with dry needling therapy and are certified to perform this procedure. And if you are having such issues like muscle knots or tightness in your muscles, myofascial bends, you can reach out to our clinic and get yourself treated. Feel free to reach out to us in any of our clinics, and if you have any queries you can contact us. I hope you like this video. Thank you.